So for this installment of Current Reflections, we're joined by Joe McDonald. Dr. McDonald took the helm as president of Salish Kootenai College in 1978 and served in that capacity for over 30 years. A giant of the tribal college movement, Dr. McDonald earned his doctorate of education at the University of Montana and went on to serve as a councilman for the Confederated Salish and Kootenai tribes. He also worked as the Title III program director at Flathead Valley Community College, where he helped establish both SKC and Blackfeet Community College in the mid-1970s. Dr. McDonald's tenure as president of SKC emerged as a leader in developing new programs and was one of the first tribal colleges to offer baccalaureate degrees. Today, SKC is the only tribal college to offer a bachelor's degree in nursing. So thank you for joining us today, Dr. McDonald.
Oh, you're welcome.
It's great to have you here. And I just wanted to see if you could tell our listeners a little bit about how and why Salish Kootenai College developed one of the first tribal college nursing programs.
Well, we had a real shortage of nurses here on our reservation. Our reservation is served by contract care with tribal health, meaning that tribal health contracts out doctors and hospitals, and all the health care like that. They contract it, and they're in the process, developing some of that themselves now. But at that time, they were contracting it all, and there's a vast shortage of nurses. There were a hard time getting nurses, whether they were Indian or non-Indian nurses here on the reservation. The only nursing programs were in Miles City in far eastern Montana, Montana State University at Bozeman, and the Carroll College, a private Catholic school in Helena, were our only programs. And so it was hard to get in. They had long waiting lists, and so for Indian students to access it was very, very difficult. So for that reason, we wanted to get started. I wanted to see Indian nurses in the hospitals, Indian nurses in the clinics, because the majority of the patients, a large number of the patients in all of the health facilities on our reservation were Indian people living on our reservation. So that was the main emphasis why we got into it. And then we had our ducks in order really, really good. We had tried, Flathead Valley had tried to get a nursing program, and the state nursing board, just put them through a bunch of hoops, and then finally Flathead Valley gave up. And they hadn't certified a nursing program. The last one was in 1952 or 53, something like that. And here, we're in the 80s and no new nursing programs. Well, our main colleague that helped us get the college started, left and took a job at the hospital in Missoula as a grant writer. And so he got to go all the meetings with hospital managers and got to know the hospital situation really well. And so he really did a lot of work in getting that first nursing program approved. We first wrote a Title III grant and got the money in the Title III grant to hire the beginning people to lay the groundwork for nursing and get the first classes started. And then we applied to Kellogg, and we just happened to hit Kellogg Foundation right and got a good shot in the arm from Kellogg to really get it off the ground. And so we're really proud of it. It really got off right away, and our nurses right away gained a wonderful reputation. We had great nurse instructors, and everywhere I'd go, I'd see doctors or hospital people, and they'd say, "Boy, Joe, you sure put out a good nurse from that college." And it really made our school quite well known in the nursing field.
That's great. What other sorts of impacts can you say that you've observed that that the program has had on the Confederated Salish and Kootenai tribes?
Well, we have Indian nurses in the hospitals, in the rehab facilities, the long-term care. We have Indian nurses that are there. We have been able to, the tribal health has been able to hire many of our people, as nurses in their programs, and it's just had a great impact. And Indian people being cared for in the hospitals, by Indian students, and I think we had a great impact on how the hospitals view Indian patients and view the Indian culture and respect, the way Indian people, want to be treated when they're sick. A lot of people come, they fill the room when they're really sick, and they stay maybe 24 hours. They may want to smudge the patient, There's so many things that we're able to do now that we couldn't before, so it's had a real positive impact on our tribe. And then the non-Indian nurses, they're so much more ready to serve and more knowledgeable of Indian people and treat them so well. So it's been a win-win all the way around.
Oh, that's great. SKC now offers a bachelor's in nursing degree. Can you tell us a bit about that program and its significance?
Well, it seems like so many offices, like the public health, they wanted bachelor's degrees in nursing. We had a hard time getting our 2-year nurses approved, for work with them, but they wanted bachelor's degrees nurses, and it just seemed if we were going to get any master degree nurses or nurse practitioners or nurses with doctorate degrees, we had to make that next step and get a bachelor's program. So we started a bachelor's program some years ago, and it started with the students would finish the 2-year degree first and pass the NCLEX exam, and then they'd be admitted into the bachelor's. And it was kind of some classes were at our college and some of the classes were online. What we've done now, though, is they've not doing the 2-year anymore. It's straight bachelor's, so you come into the bachelor's program right away. And I think they can build a more curriculum that serves the bachelor's degree better than the way we did it before. So that's what the program is now. It's a straight bachelor's program, and they come in and start right away with bachelor's training and go all the way through.
Okay. Now, you mentioned smudging earlier, but how has SKC incorporated traditional Indian healing practices into its healthcare programming?
Well, just by, talking with our cultural people and becoming knowledgeable of our cultural people and respecting, how they feel about medicine. We don't, I'm sure that the nurses don't administer, the Indian medicine that they use. That's Indian medicine is done outside of the formal medical field on our reservation. It's done outside of the formal program. So, if you're going to use a certain root, or you use something for sore throat or something for this, you would do that at home under the watch of the Indian medicine man, and not the doctor at the hospital. But I think the doctors at the hospital are more respectful of the medicine man and the healing that's done, because really, when you think of all the healing that we do, much of it historically goes to practices that they picked up from the American Indians when they came to the North American continent and South American continent. Much of it is, picked up from that. So I think, it's well received. They work together well, and people feel good about it.
Great. In the article Culturally Congruent Care, featured in the summer issue of TCJ, Salish Kootenai College nursing instructor Lisa Harmon notes that students at the tribal college are community spirited. Can you elaborate on that?
Well, the Indian students that come in, they come from Indian communities where they've done a lot. They've cared for elders. They've done a lot in their community. They've cared for little ones. They're just we just get complimented all the time about their willingness to roll their sleeves up and get right into nursing, whatever it might be. And then the community spirited part, to work in the community and like help with the vaccinations and all the things that happen in community clinics. Our nurses have a community clinic in the spring of the year where they come in and they examine. You get a lot of different examinations, and it's going to be bigger and bigger each year. And I think that's what she meant by the community spirit.
Okay, for other tribal colleges which see a need for a nursing program to serve their respective tribal communities, what advice can you give in developing and implementing one?
Well, I think we have a good format at our college, and I'm sure that our people would be willing to step in and help them. I think one of the big changes we had in Montana was a change on the nursing board. We had the nursing board in Montana was chaired by the director of nursing at Montana State University, and she didn't want to have any more programs. And so when her term ended and she finally went off the board, is when we got permission to, do a self-study and present ourselves for accreditation to them. And she came to the meeting when we were being considered for accreditation, and she just really laced them verbally, for letting us get that far. We never should have been given permission to do a self-study. Well, that attitude with the nursing has changed, and they've since approved nursing programs at some of our what we used to call state VOTEC schools, Missoula College, Great Falls College, Miles City College, Community College, and Billings. They all have nursing programs now, and so I think it's a much easier way to get a program started. If you can, get the money to hire the nurse director, who needs to be a master's or a nurse practitioner, or maybe a doctorate in nursing. I'm not sure what the requirements are, but need to start with that, and then lay the program out and see, you need a couple more nurses for instructors, and then you need to lay out, where they're going to train at, visit the hospitals, the extended care places, and get that all laid out. It's quite a, it can be done. It can be done, in steps. It's not impossible. It's costly, but but it does pay for itself, because you get the students coming in, and generally you get the Indian student count for them in pre-nursing and also after they get into nursing. We find that a lot of our students in rural Montana come in and they have to do a year of pre-nursing first and get a lot of these required classes out of the way, get the chemistry and the anatomy terms, whatever they call that, terminology. There's a lot of these pre-courses that they get out of the way in pre-nursing before they come in, and so you get that count, then you get the count of the student in nursing, and then and I think retention is much better in nursing because they're more focused. They just made our college. I mean, we couldn't get a advanced math class. We could get beginning algebra, but we couldn't get enough students to finish a college algebra class until we got nursing. And nursing college algebra was required, and those nurses just tied in and did it. And when the other students saw them doing it, they all jumped in. And now at our little college, we probably have any quarter, we probably have at least three classes of college algebra. They just influenced that way. Same way with chemistry, those courses. The other students see them doing it. They're really focused. And so for a student at school, that's rural, that doesn't have nursing or close by, or they can do it. They can start it and they can do it, and be surprised at the outstanding students that they'll get.
Are there some other major challenges, or can you maybe identify some pitfalls for tribal colleges thinking about implementing such a program that they should avoid?
Well, I think one of the big things we had a hard time, teachers are kind of social scientists, and we kind of generally get it right. But with nurses, they have to get it exact. And the vice president would come to me and he'd say, "Joe, they're too hard over there. You're not passing them for this or that." And I'd say, "Well, Jerry, when you're laying on that gurney and that doctor says so many cc's of this and so many of this, you've got to have it right. And there's no generalization in the program with nursing. And so there's kind of a mental attitude that has to change. That people, just because you want to be a nurse, you're not necessarily going to make it. If you don't understand the exact science of it and the background that you have to get into it. And so you really have to study hard, be willing to study hard. A lot of them came in, they'd come in and they think they could just push it right through like you do some of the other courses, but they just can't. And every spring we would have a real controversies over some of the students that didn't make it. Mm-hmm. And it's a lockstep program. You come in your first year and you're lockstep that year. You take this course fall semester, this course spring semester, and then the second year you take this, you take that. And if you fail one of those semesters, then it throws you all out of step. And so it's really hard on families. It was hard on families when their students didn't make it. They'd feel bad and criticize the program and all that. And you have to be willing to stand behind it. And certainly have to have you have to be human about it and caring. And you wouldn't be a nurse if you weren't caring. And so they are, but it is a very strict science. I think that's a pitfall. Money's a pitfall. You need to have money to attract nurses out of these hospitals. Like you want to get a doctorate in nursing, then you've got to compete for the salary that they could get at a large urban hospital. Not large urban, but urban in Montana. They can go to hospitals and get a pretty good salary, and you pretty much have to match that, or make it up with working conditions, and that's real hard in some of the real rural places where you don't have housing or don't have the facilities and all that. It's real hard to make it up. Out here in western Montana, it's a real pretty place, and people love to be around Flathead Lake or around the Mission Mountains, and so we get scenery as part of the salary that we're able to attract them. And then we're not too far from Missoula or Kalispell, where there are large hospitals, and so they're willing to come out and teach. And I think teaching is more relaxing for them probably than being on duty walking the floor like they have to do. So I think that's something they have to consider. And then the nursing students, they have to have be able to come in, and many of them have families, so you need to have some kind of living conditions for them. And then when they go do their practicum, if they live in Pablo, where our college is, and their practicum is in Missoula, that's 60 miles, and it's 60 miles to Kalispell. So you have to have a way they usually would schedule them to be on duty for the 4 to midnight shift, or 3 to 11, whatever it is, shift the first day, and the second day they would be on the morning shift, so they don't have to stay over one night. And that's an expense when they stay in a motel, or some of them have family that they can stay with. It's pretty hard with that kind of a assignment to drive back and forth, because you'd get off too late at night and have to be there too early in the morning. Mm-hmm. So that has to be figured out, too. So those are all administrative details, that you work out. Kellogg was very good with us. They gave us money for a van, and we were able to carry the students down to Missoula and for their evening shift, and then they would stay around town with friends or motels, and then we'd bring them back the next day. Most of them, though, usually had their own cars, and it wasn't necessary to have the van. But it is, we thought that would be an answer, but they really took care of it pretty much themselves when they know and plan their finances that way. Yeah. They're trying to get more practicums, close by too, using the rest home facilities, the other nursing facilities we have in the valley. There's a lot of private industry with elders, and they try to work that in too. The baccalaureate program prepares them to be more of a community nurse than does the 2-year. The 2-year is just straight slam bang, straight nursing. And the baccalaureate, you can work in the community stuff, the social work, and makes probably a better rounded nurse in the long run. Although the hospital and the doctors love the 2-year nurses. They just love them because they say a lot of these nurses that get their baccalaureate degree, they want to become administrators. They want to clean up messes and change bedpans and help people shower and all that. Like they like. Whereas the 2-year nurses, they say, "We'll jump right in and do all that." Yeah. So the doctors had their way. It would be 2-year nurses.
Yeah. Apparently, in the article that I referenced earlier, "Culturally Congruent Care" by Dina Horwoodell, that's in this summer issue, she mentions that studies have shown that nurses who do earn a baccalaureate degree make fewer errors than those with an associate's degree.
Yeah, I don't know what that would be. Administering prescriptions or doing those IVs things, getting at that right. I don't know what that would be, but it might be so. I know they're probably more community minded. Yeah. I think what happened in the beginning was the nurses were from middle class families, and they'd go down there to Bozeman at 18 and they'd be out at 22 and never had really, maybe not even changed a diaper of a baby. And all of a sudden you're thrust into that, and they want to get into administration. They want to become a community health nurse, not the kind of nurse that works on the floor.
Yeah.
That's my own theory.
Yeah.
My nurse director would probably cancel that theory.
Well, great. Thanks so much for joining us today.
Well, appreciate it. Hope I didn't ramble on too much.
No, it's always great to hear from you, and I know readers will be thrilled to hear from you as well. So thanks again.
Well, thank you for including me.
All right. Take care.
Yeah.